This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
I'm Dr. Bill Adams, and this is No Spin Live, where you get the real story from the world's top plastic surgeons. We've got a great show for you today. We're going to be talking about a nurse's plastic surgery horror stories, the Australians in medical tourism, and last but not least, the 5 best countries to go for your best cosmetic surgery experience. We've got a great crew with us today. We're going to start with Dr. Brian Brzezowski from Salt Lake City, Dr. Jason Posner from Boca Raton, and last but not least, Dr. Stafford Bruman from the Big Apple, New York City. Before we get going on the stories, guys, there was a survey that just came out where they surveyed this question to people. I think it came out of the UK, and the question was, at what age is it not cool to wear jeans? Like, what age should you stop wearing blue jeans? So I just thought it was interesting, and I started thinking about this. So I want you guys to kind of tell us your thoughts on that. Brian, what do you think?
Well, I think that has more to do with, how you look in your jeans. And, if you're a rocking 50 or 60-year-old, then by all means, I'd say do it. But, if you're starting to sort of, need to loosen the belt up a little bit or unbuckle the belt, then I'd say maybe it's time to walk around in your sweats all day long.
So Stafford, what do you think? At what age should you quit wearing jeans?
Blue jeans are pants, so I think we should all be in some sort of coverage. So I'm not against them. It depends on what they look like. The other question might be, when do you stop wearing mini skirts? So, that might be the corollary, but I think you can wear jeans most of your life, just as long as you don't try to relive your youth in them.
The survey, again, was done in the UK, but the survey said 53.
Well, first of all, you can't see me, but I'm wearing jeans now, and I'm older than that, so I don't agree with that at all. I think maybe...
Hey, Jason, time to hang up the jeans.
Yeah, I think maybe we shouldn't be buried in our jeans. But other than that, I think you're pretty good until the time you need to get buried.
I totally agree. I'm wearing jeans, well past whatever age. So, all right, well, let's get into it. This first story is a nurse that's been a cosmetic surgery nurse for 7 years. I'm not sure that's a huge long time, but she's kind of telling the horror stories and the different things she's seen. And we thought this was of interest because there were some insights and some of them interesting. But Brian, what did you think about this story?
Well, the first question I had was, who is she really working with? Because I think we all understand that this term cosmetic surgeon really doesn't mean anything. And too many times it actually is sort of a mask, if you will, for what the person's real underlying training is. So if her cosmetic surgeon that she was working with was a pediatrician doing tummy tucks, I would expect her to have a lot of interesting stories, unpleasant, unsavory, but probably interesting. If on the other hand, she's really working with a fully qualified trained plastic surgeon who does a lot of cosmetic surgery and maybe takes on that term of our title of cosmetic surgeon, then yeah, perhaps maybe, she just sort of sees that ebb and flow, if you will, of most of our practices where we have, some things that are kind of exciting and sometimes a little bit too much so. And we see all different types of patients who, sometimes sort of make us wince a little bit, but at the same time, the average plastic surgeon sees really normal kind of people. So, most of the problems that I think she ran into probably were the result of maybe some unsavory practices.
Yeah, Stafford was a little over the top, like duct tape on breast incisions, and the girl that went to have a labiaplasty at that tattoo parlor. Come on, man.
We've talked about this before. You get what you pay for. And it's more complicated than what you think. So you want to go to someone who's qualified, someone who's trained. In this day and age, it's very easy to do your research. You can find out if it's a good person or not, a good doctor. So that it's not as hard as it was before. You can really find out who's qualified and who's not and what the data is on them and go to someone who really knows what they're doing. This is not something to be taken lightly. These are surgeries. They're very important. All surgeries are big surgeries, as we say.
JP, what's your take?
You know what? I would say more than 50% of my practice is revisionary plastic surgery. So I see lots of things that either aged or just was done poorly. And once in a while, you'll see some disaster that came from out of the country or something else. But a lot of times it happens in our backyard and even can happen to us. Saw a case today that a lady had a bad mycobacteria infection of her breast. It happens. Bad things happen. People have to heal. And sometimes healing's not as nice as we would like. So it's how you handle those complications. So you know what? Buyer beware, do your homework, and even in the best of hands, problems can happen.
All right, I think those are some good comments. So let's move on. Let's go to the next story, which is on our partners down under. And you know, we just started No Spin Live Australia, and we had Craig Layton and Tim Papadopoulos on. But there is a problem with many Australians going apparently to Thailand and some other countries for medical tourism for kind of cheap plastic surgery. And despite some pretty graphic issues that have come up, you know, apparently people are still going there. So, Brian, what do you think?
And we know there are some magnificent plastic surgeons in other countries who do wonderful, wonderful work. I think this story highlights a little bit more of the sort of underbelly of some of those areas where, you know, basically they're not going to the more reputable type of folks who probably charge a little bit less than what they might end up having to pay in the U.S., but they're going to someone who's a lot cheaper than the plastic surgeons in that area. And consequently, like we've talked about many, many times, you know, buyer beware. You know, they're kind of, you know, sacrificing their health for a little bit of savings and cost. And so many times when people try to do that, it ends up turning around and biting them. In fact, you know, what happens when you saved a little bit of money on the front end, but now the complication costs 3, 4, 5 times the cost of the original surgery to correct, if you can correct it. So ultimately, if their priority is shopping for a lower price and they're going to these facilities or some of these, you know, doctors, or maybe not even true doctors, they really are, you know, not setting their priorities right. And it doesn't surprise me that they run into problems.
It sounds like cost is the driver here, despite the bad stories.
It's penny wise and pound foolish. And it's even more complicated than that, because as we know, when we do complicated surgeries, the preoperative management, postoperative management, that's all part of the surgery. And it's also always, or most often, best to be at a home base where you have friends or family helping you through the process. So if you travel, now you've taken yourself out of your own element, and then you're trying to be short on the money. So I think it's many factors, but one of those factors is penny wise, pound foolish, and the other is trying to be at your home base and get you through the system, through the surgery, through the preoperative treatment and the postoperative care, which is also part of the healing.
So Jason, you know, the Aussies, you know, we know a lot of them, they're great plastic surgeons. You know, they have actually done a ton in terms of advocacy for patient safety, but they still haven't been able to put a dent in this. I don't know, maybe they need a couple more cleansing nails, but what can you tell the Australian people about this?
You know, it's interesting because this story hits somewhat close to home, because this is a discussion we had at home this week. So Yvonne's girlfriend, one of her friends, wanted to take her mother to Malaysia, which is one of the countries mentioned in this article, to have her teeth done, because her full mouth restoration would be $60,000 in Florida, but would only be $15,000 in Malaysia, where they had to stay for 3 weeks. And I exactly said the same thing. Well, suppose you have a complication. Who's going to fix it? Suppose you break a tooth. What's going to happen then? Suppose you have a complication there with anesthesia or an infection. How are you going to manage that? So to me, it scares me. And I think, again, as Stafford quite eloquently said, it's penny wise and pound foolish.
We're going to move on to the last story. This was sent in to us by one of our viewers. It's about the 5 best countries to have the ultimate cosmetic surgery experience. Kind of interesting. They wanted to know, Jason, I'm going to stick with you. How legit is this list? You've got United States, Brazil, Japan, Italy, and Mexico.
You know, so I looked at this and I said, well, where is the most cosmetic surgery done in the world? It's probably on those countries. So that's the place to go, because we probably do the most. We've been doing it for the longest period of time. We know our Brazilian colleagues are very involved in cosmetic surgery, and we're actually, you know, more involved than the United States in times past. So I agree a little bit with the list.
There really are great surgeons throughout the world. I tell people, you know, you don't send your shirts to be dry cleaned to Malaysia or wherever you want to go. You do it sort of where you are. You can find someone who's quite talented, probably in your neighborhood or vicinity or region. I don't necessarily say that you have to stay in, Oshkosh, where there probably are good surgeons, but, go to where the surgeries are done on a regular basis proficiently, because, we are masters of what we do, and we do these things proficiently. So you want to go to the masters.
Right. Yeah. But I think there is a little bit of danger in saying that people can't have good outcomes and good surgeries in other places, because I think they can. And I think we, run into the pitfall of saying, oh, why would you ever have surgery down there? Because there are examples of people who've had lovely results. It's just, what's the magnitude of the risk they're taking by doing it in that location? And sometimes they fall off on the negative side.
Well, the real deal is people come to the United States for medical care, and there's a reason for that.
Exactly.
All right, well, I'll tell you what, those are some awesome insights, and I'm sure our viewers learned a ton. And if you want to see more of that, you can see it on theplasticsurgerychannel.com.